I went over, remember po nung ano, nung they asked or they sent you an email regarding a survey, quick, very, very quick survey. That's actually a survey I created for me to know kung paano natin gagawa ng structure or direction yung magiging session natin this morning, especially it's the first session. And I'll be showing to you the results in a few, but before we get to it, I believe that not all of us or all of the participants are in the mental health profession, but yung idea lang na they're here and they're willing to learn. I hope ganun yung ano natin, yung mindset natin, no? More than the CPD points. We are willing to learn and we wanted to partake and we wanted to share something after. Sana yun yung mas maging goal natin, no? At the end of this one-day session or talk or seminar. All right? So our topic really for this morning is all about psychological first aid. I was contemplating about this topic early on, even nung una-una pa lang before we were supposed to have it physical nung March, and though I've this is not the first time that I've delivered this, but I really wanted to know kung ano yung magiging background ng participants natin, because psychological first aid is actually something that's done in a workshop, no, or a training that's conducted. So having a talk like this is actually quite challenging, no, for us to say na after this talk baka sabihin ng iba na I am capable, no, or I think I can do psychological first aid. Well, partially yes, but not absolute, because again, this is actually a skill that we have to master, no. It's something that we really have to train ourselves, equip ourselves. Now, I remembered we had my first experience with PFA way back was with BAG. No, we've had it with Ma'am Austria for Doc Austria in the graduate school in Benguet State University. No, and it took us actually like half day to get to know this really, because again, it's a skill that you have to really master and get equipped with the basics of it, like how you should be delivering it, when. Even communication skills is actually included. Again. But nonetheless, I tried my best to put things together, everything that I think I need that everyone, for everyone to be able to understand at least somehow or get a grasp about psychological first aid. All right, so yeah. So here are the things that I hope at the end of this short session with me, because I think it's just like around a maximum of 2 hours. So I hope at the end of this particular session, you'd be able to understand for those who have not met this term yet or who haven't encountered PFA just yet, understand the basics of it. But for those who have familiarity about PFA or even expert of PFA, I say expert because I'll tell you why in a few, no? At least review natin, no? And probably sharing of best practices. So you might have done it in the past, yung mga bagay. You might have done PFA in the past, and there are good practices that you encountered or you've done. Then probably you might want to share it also for the others' sake. All right. And then another one is, at least at the end of the session, you're able to identify the core actions and principles of PFA. Why PFA existed, and why we need to do PFA. Or how PFA got to prominence, no? Or paano nabuhay or paano namigyang kaluluwa at katawan ang PFA na ginagamit natin ngayon, na kung minsan overrated na, pero hindi actually, kahit sabihin overrated, hindi pa rin naiintindihan kung what PFA is and how it's done. So this will get to know more about that. And another one is appreciate the CAP or the core principles as seen in some models. So I'll be showing to you 2 common models. One, I know that most of the participants are familiar with or may have heard of it. That's it. I'm getting it from the responses you sent, no, dun sa survey na pinadala natin, no. And then another one also is something that I've learned online, but I feel like it's very applicable because it's very practical. All right, so I'll be sharing that to you in a few. And last but not least, we'll try to know current trends of on PFA or in PFA. So how is PFA applicable, probably, especially with our situation now, that we're currently undergoing a crisis, a health crisis. So these are the things that I hope at the end of this particular session, you'd be able to get, or mabaon ninyo. So habulin nyo ako pag ang mga ito hindi natin na-satisfy, ha? Ayan. Kasi importante meron tayong direction really, all right? Because it's useless if we don't have anything at all in mind. All right, so moving on. Ayan. So you and me, I would want to really establish settling ground muna tayo. No? I've learned this sa BSU. Yeah. This is the data that I'll be showing to you again is lifted, or it's gathered from the results of the survey I sent. So I want to know more about you so that meron tayong at least common ground. No? So hindi tayo, antag dito, walang naiiwan, wala ding sumusobra. Yung mga ganyan. So at least tamang timpla lang. Sabi ko kanina, tamang timpla lang tayo lahat. All right? So with the survey, I asked you, remember, I asked kung how, or if you're going to rate your understanding and knowledge about PFA, ayan, ganito yung naging results. Out of 43 participants who sent or who answered the survey, ayan ang lumabas. So from 4 going pababa, may 7. Ibig sabihin nun, meron has little or no knowledge about PFA just yet. So kung titingnan natin, probably because they are not part of the mental health profession. So with this idea, it gave me a picture na okay, baka gusto kong ayusin yung magiging direction ng talk ko ngayon. At least ma-meet natin sila halfway. Alright, because if you look at it, there are 2, titingnan nyo dyan, the dalawa ang experts sa field na to, experts sa field of not field, but in terms of PFA. So kung sino yung mga expert na to, I hope you could share also something, sana, so that we could also meet the others who are, nandun sa pababa. But nonetheless, meron naman tayong 10, nandun sa middle part, actually sa 5, score na 5, they scored it 5. I don't know if they played safe, but they thought na siguro, I'm not very knowledgeable about PFA, but I'm not knowledgeable about it. So I have an idea about what PFA is. And around 24 out of these participants, or you participants, has good understanding somehow of PFA. So with this picture, or with this thing that I'm showing, it gives me an understanding again that okay, so siguro ang gagawin natin, ang structure ng PFA natin ay hindi masyadong technical, hindi rin masyadong from the bottom, all right, or like from square one or from step 1. No? So at least nakikita natin na ganyan, right? So another one, yan. 61% of you has no direct involvement despite those numbers provided earlier. It's surprising that kahit marami sa inyo, it's like a big chunk, even like around 70% or 80, even 80 of the participants who responded, walang direct involvement. So, ibig sabihin ba nito, you know what PFA is, pasikot-sikot na konsepto about PFA, but you haven't done it actually. Also, kung isipin natin, you're more of you know the theory, but in terms of practice, medyo yun ang kailangan nating habulin. So, well, at least we have a picture again, At least meron tayong nakikita na ganyan. All right. So, and last but not least, from the survey I've got, from you participants, there are 60.5% not necessarily a mental health profession, which makes me happy. You know why? Because this gives me an idea that, kahit hindi ka MH professional, but you're willing to learn, Again, aside from the CPD points I mentioned, sana hindi yun yung tinitingnan natin, but at least we are able to, yung excitement or yung eagerness natin to know more and to learn more. And looking at the background or the profile of the participants, mostly are not really mental health professionals. They are probably working in private organizations, in public or in private, ano pa, public schools, and mga yan. And what makes me motivated to really share this particular topic the best I can is that having these people not necessarily mental health professional at gusto matuto about PFA is good because you'll know why the PFA is not something that's actually it's only done by mental health professionals. Also, everybody is actually capable and is in ano is or yeah capable of delivering it for as long as you have the right skills and the right training. No? And again, with this picture, it gives me an idea na baka gusto talaga nila and they're interested and they're willing to know so that they could share also. Sabi nga nung team natin, you learn now so that you can share eventually. That's giving back. All right, giving back. I learned from BSU. That's nice. All right. So ayan. So moving on to start with, yan. So PFA, you have there across the many resources that I can find, ito yung pinaka-prominent na definitions of PFA. So you have there from World Health Organization, National Psychotraumatic Stress Network, International Federation. Ito yung mga naging standard na pinagkunan ng definition of what PFA is. So you see there, you have, just to read one of the definitions, prominent ones, you have there from University of Minnesota, sabi say, PFA aims to reduce stress symptoms and assist in the healthy recovery following a traumatic event, natural disaster, act of terrorism, or personal crisis. Now, I asked also in the survey, what comes into your mind when you hear the word PFA? And surprisingly, lahat ng mga sinagot ninyo nandito sa mga ito, kaya ito yung kinapture ko na definitions. No? So, it gives a validation na actually, yes, siguro nga tama yung 61% doon na most of you have enough knowledge about it, but siguro in terms of really actually doing it, yun yung medyo kailangan talaga natin habulin. All right, so these are the different definitions of PFA. So I'll give you more of it and a few as we go along, but at least we have this one to say na, to give us an idea what actually PFA is. All right, so moving on. Yan. So before it get even, before we have the PFA that we know today, this actually went through a lot of changes. Now, for the others, especially for yung mga nag-uumpisa pa lang matuto about PFA, ganito po yung naging transition niya. So, it's for some, they say that PFA is just a new, kumbaga baby, technique or approach in dealing with crisis. Yeah, well, it's true, especially here in the Philippines. A research done by Hechanova and company in De La Salle. In Ateneo in 2017, sabi na they really found out na batang-bata ang PFA, especially here in the Philippines. But did you know that PFA actually existed even after World War II? It was there. It's just that iba-iba yung naging tema niya, iba-iba yung naging term hanggang nag-evolve sa kung ano yung PFA ngayon. So it actually started off with critical incident stress management / debriefing. No? So in the past, ito yung ginamit nila, and it was originally used by firefighters or first responders, medical first responders in the past. And eventually it transitioned to disaster mental health, because they thought na baka we have to be more crisis, yung approach nila is crisis mitigation. So ginawa nilang disaster mental health. And then eventually, they found out na mukhang may kailangan pa tayong i-check about how we are doing it. Now, how about we try to focus more on really trying to help the person or help the individual undergoing crisis. That's why we have this PFA. And I'll be showing to you the transition from World War, after World War I or post-World War II until what we have now. All right, so this is just an overview, by the way. This is just an overview, which is part of our objective number 1. All right, so ayan. So in 1962, that's post World War II. So that you have there the person, ayan, ay, hindi pala nakikita yung pointer ko. Ayan. Ito, si Von Greyer, sabi niya, he actually initiated the idea of doing PFA. So remember yung unang term niya, it's the debriefing, it's a mental health, I mean, it's management, crisis management. So basically, ang goal niya dyan is to permit everyone to have their own emotions, psychological incapacity as and has to be seen, or patient has to be seen as psychological incapacity as an injury and all those stuff, no? So ganito yung naging umpisa ng PFA, yung idea about PFA, because they've seen that after that a lot has been going on, no, after the World War, no? So they have to recover, and they've seen this experiences of these people, no, in the West at least. So after this, in 1982, so from that point until 1982, ito yung naging tema, understanding nila about PFA, or about psychological first aid, with its first term, or with its first name, sorry, not first term but first name. Then eventually, by Singer in 1982, inintroduce na, baka gusto nating incorporate, suggested 9 steps of it. Now, if you want to know more about this one, I'll be willing to share to you the material where I found it. All right, but if you're familiar with it, well, that's good. All right, so yeah, in 1982, then eventually in 1986, ayan, lumabas itong 11 steps in conducting PFA. So yeah, you have there the comforting and consoling, kasi over time ang dami na nagiging changes in relation to the different needs and the different situations also. All right, so they've upgraded, they differentiated it. They've changed, they've added, they've renewed sa yung ibang konsepto, no? So you have there the 11 steps as introduced by Raphael in 1986, and lately, ayan, in 1990, focus stress. They focus, or Walker introduced the idea of focusing on stress diffusing, and it's more general than the latter. So more general siya kaysa dun kay Raphael. So ganyan yung naging transition ng PFA. So again, this is just an overview, all right? We will not get into detail of it. I'm just trying to present to you how this came about, all right? And in 2003, I think this is the latest after a lot of research has been done already. No, nag-evolve na ang research about PFA. So in 2003 by Ritchie, they focus including activities. So hindi na lang siya about understanding, engaging with the person, to like talking, understanding where they're coming from, knowing their emotions and feelings, but putting in a way dapat meron din, it's action oriented, no? They have to do something to help themselves out, no? And you'll be able to identify later on that this is the empowering part actually that we adapted with the new idea of PFA now. All right, so ayan, so they've included activities to be conducted within the 48 hours after an event. So after that, you have to give something to the client, the individual, the patient, no, just using the terms they use in the past about PFA. Yeah. So that's basically the evolution of how PFA came about today, and this is what we have now. Also in 2011, the World Health Organization introduced actually they developed this guide for everyone to use, especially kahit hindi ka mental health professional, basta na you've undergone training, you've equipped yourself with training and enough skill about PFA, then you can actually deliver this. And this is where they're coming from, the evolution of it. So after this different definition, this different perspective about PFA after post-World War II, ayan, sabi dyan, PFA is actually a method and or an approach in trying to provide, help, protect, and support individuals who are undergoing distress or traumatic experiences, no? And it's incorporated there that it should be humanistic, no? In the sense that we are not just basically targeting kung anong nararamdaman na, but we try to help them out even after we provide the immediate needs that they have. Yeah? And then you'll be with the models that I'll be showing to in a few, as the models I've found out, that you'll see there that hindi na talaga siya natatapos dun sa okay, nakapagbigay ka na ng tulong sa tao, napakinggan mo na kung ano yung pinagdadaanan niya, naibigay mo na yung physical needs or nakatulong ka para mai-provide ang physical needs niya at the moment, and you're able to establish linkages na hindi lang siya dapat natatapos doon. So it should be after that, ayan, meron tayong follow-up, ayan. And we try to treat these individuals as something na hindi, I mean, not the traditional, not the archaic, if I may use the word archaic, understanding of who the person is. You know, that they are like patients who are like needs to be treated. No? Hindi ganyan. All right. So they are going through something, and they basically need all of this ones. They need to be provided with the basic needs. Like for example, if they are in a situation, like for example, disaster, no? After disaster. So, ano yung nawala sa kanya dapat i-provide nyo? Like, for example, food, basic needs. In Maslow's hierarchy of needs, just getting it from that point. No, basic needs nila, pagkain, tubig, shelter, yung mga damit. That's providing and helping in the sense that you doing that also is actually an act of help already, no? Like trying to basically get as much as you can to provide, actually, to share, no? And then protecting in a sense na make sure that especially like people who underwent abuse, that they are protected in a sense that they are secured after that incident, or probably there is help, or you know, they feel like they're safe, yeah, and then supporting, no? That's even after. All right, so that's PFA with the definition na kung ano na yung, kung how we see it today. All right. Now, with these definitions, just going back to yung first slide na pinakita ko sa inyo, and over, anong tawag dito, ang pinaka-prominent na salita na mahanap natin dyan, why we need and why we have to have PFA is the word, or yung idea of, or the term stress. No? So, people actually are experiencing this after a certain event or incident in their life. No? You know that stress is something that actually, okay, it's actually good, no? It has an adaptive and functional purpose. Like in a sense na under stress, we're able to, you know, protect ourselves, safety ourselves, in a sense that we respond to certain threats in a way na appropriate. But for some, ang stress kasi hindi siya tinitingnan, or hindi, it doesn't end up just like that. No? For some, this particular stress caused by these traumatic events, no, that could be disaster, trauma. I think I have it there in these few slides, no, where this stress are coming from. Again, crisis, personal crisis, trauma, ano pa, accidents. Actually, lumabas din ito dun sa survey na pinasagot ko sa inyo. And they are actually true, no? So if you look at the different, how do you call this, resources available, no, tama, consistent siya. So apart from that, crisis, victims of war, yung mga ganyan, ano pa, and a lot more na, you know, all experiences that heighten stress that can lead to distress. Yeah, yung mga ganyan. No, so and with that, PFA is needed to anong tawag dito, to ground back, or kumbaga ibalik nyo sa normal state ng pakiramdam, ng emotion, ano pa, ng normal state ng pagkatao, no, after a certain event, no, that transpired. All right, so understand it. I just wanted to show it like this, no, na after a certain stress or a stressful event happened in someone's life, ito yung nagiging direction niya. Let me just hide this real quick. Ayan. Alright, so ayan. So yung stress na sinasabi ko sa inyo, at some point kasi, there are people who are able to manage their stress. In fact, sabi nga nung una, like the first one who created or who provided the understanding about PFA in 1962, sabi niya, stress, may mga tao na after a crisis or after an adversity in their life, they're able to go back. No? Kaya nila mag-cope on their own. They don't need help. But there are also individuals who undergo certain, same event, certain crisis, certain adversity in their life. Na at some point, they got stuck to it, or kung minsan, they even get to an extreme point na nawawala na sila sa direction nila. No, they lose focus, and they lose who they are at some point. And to be able to help them not end up that way, or not getting not being in a position na ang hirap ng ayusin yung mga yan, there has to be something, or kailangan may magawa tayo, or may magawa, sa kanila. And this is the idea of PFA. To be able, PFA would allow this individual to actually go back to their coping and stable conditions. All right, so that's the idea of PFA, and that in itself would give you an idea, which actually, again, galing sa mga responses nyo, at least I'm happy that you're aware, the different conditions or the different conditions, and understanding that what PFA is not. You'll see that actually in the material sent also by WHO. And if you don't have that, I'll be glad to share it to you also. But you can actually access that online. Know that PFA is not actually something that you do. It's not the same as counseling. It's not debriefing already. It's not a therapy in itself, but rather, again, just getting it from this picture, it's something that you do, again, to help, to support, to protect the individual after experiencing a certain crisis, to go back to coping and stable like, again, the components of it, like protecting, assisting, facilitating, providing, helping, and you'd be able to help them go back to this state, and not progress and create or develop more serious concerns or problem because of the crisis, or because of the distress, adversity that they experienced. And so I hope klaro po sa atin yan, especially for those who are new to this term or not very familiar about what PFA is. All right. So again, it's not something na sasabihin natin, may problema siya sa ano tawag dito? Nabaliw siya. Yan. Ito yung common na narinig, nabaliw siya. Tapos, anong tawag dito? Kailangan niya nating i-PFA. So, baka may mga gusto nating i-check doon. Baka hindi PFA actually ang kailangan niya. Yan. Hi, sir. Hi, sir Manny. Okay, so moving on anyway. Ayan. Oh, sorry. Ayan. No. I was mentioning about the different crises where stress can develop. Ayan. I just mentioned in passing a while back. Ito yung mga yan. So you have there. Death, even death. Calamities, abuses, personal crisis, abrupt changes in life. No, like for example, bigla kang napunta. Like for me, I suddenly at an instant from Baguio here in Manila. No, so and I've never been to Manila in the past, no? Parang first time ko mapunta mapasok sa Manila kasi actually I didn't, just from experience, hindi ko pinangarap magtrabaho at hindi ko nakita ang sarili ko na magtrabaho dito or mabuhay dito sa Manila, but it just happened, no? And I had to, to cope with it, no? And for some who are not able to do that, ayan, PFA might be applicable. Like for example, tingnan niyo yung mga students na napupunta, or kahit hindi students, yung ibang tao na pupunta sa ibang lugar na changes. These are part of life changes, abrupt changes in life, no? Hindi nila ma-manage ang homesickness nila. Yung minsan may mga naririnig ako, they keep crying. I encounter a lot of people, clients that because of that sudden changes in their life, they keep crying, nahihirapan sila makatulog, and probably PFA may be applicable for them to help them, facilitate their experience or their life to go back to sa coping state nila. And victims of war, yeah. So PFA has been applicable also for this one. Alam naman, it's established, that this actually evolved. PFA actually evolved after post World War II. So definitely saan ba nanggaling yung idea nila ito kundi doon. So definitely it was seen na okay, ito yung mas nangangailangan ng mga ito. All right. And then death, definitely people who have experienced death in their family, especially right now, no? Hindi mo namamalayan may nawawalan ng miyembro ng pamilya mo. At worst, you cannot even experience yung pagluluksa, no? Especially during the first 3 months of this pandemic or of this health crisis, no? That when a family member dies, and I've known a lot here in Manila at least, I've encountered clients who've experienced that. When you can just imagine yung experience na ganun na hindi mo nakita, pinasok sa hospital, hindi mo sila nakita for like a month, tapos ibabalik na lang sa inyo, sa pamilya nyo na naka-earn. Yung mga ganun. And and apart from abrupt change, this is an abrupt change, may death pa nakasama. So it's mas matindi yung impact. And definitely helping people to go back to their coping state, PFA is very much applicable, really. All right, and another one would be calamities. Calamities brought by natural disasters, or natural calamities to be exact. No, ano pa? Abuses. Ayan. Abuses could be physical, emotional, psychological abuses. No, and again, all of this one basically can lead to stressful experiences. And then at an extreme, if it's not managed, it can be very distressing, and it can create more problems, complications, and more problems that may need more interventions in terms of psychological intervention. But again, bago pa mangyari yan, there are things that we can actually do, and PFA is one of the techniques or one of the ways to help, para hindi na umabot sa ganong sitwasyon. Going back, balikan lang natin itong line natin na ito. Para hindi na sila umabot dito na maka-explain ng serious problem at mas maging matindi pa ang kailangang ibigay sa kanila, we have to do something. And again, PFA is one way of really helping these individuals. All right? So I hope establish natin kung bakit kailangan natin ng PFA at para saan ang PFA at saan kailan gawin ang PFA. All right? These are just things to know about this one. All right. Oh, hi, Paul. Shout out. Sorry, I'm shouting out. I wanted it to be interactive. All right. So I'm currently looking at the Facebook page also. So if you have questions or if you know someone, ayan. Hi, Sir Paul Nuval from DevCom. All right. So anyway, there, as mentioned a while back, stress reactions vary from one individual to another. So apart from this distressing experience, it varies. So as mentioned a while back, again in passing. For some, they are able to cope on their own over time. For some, they got stuck to it, or stuck with it. Na nahihirapan sila na ang tawag dito, to do it on their own, basically. And people who are equipped or who has a good understanding, or who have a good understanding, or who's skilled in doing PFA, you can actually help these people. All right. So if you wonder and if you question, sino bang dapat magbigay nito, or sino ang dapat, or who are the persons or individuals who are rightful, who have the right, na sabihin sila dapat ang pwedeng magbigay ng PFA. You will see that in a few. All right. So moving on. Yan. Who does it? There you go. So who does PFA? Having known how it evolved, how PFA evolved, and what is PFA? Basing it from the standard definition of WHO, and why do we need PFA? And what are the certain instances that PFA is applicable? It's also important that we know who provides this. So you see there, you have just basing it from the from WHO also, sabi dyan, people can actually do this who are part of this group, disaster response workers, first responders, medical reserve corps, community emergency response team, community healthcare providers, faith-based organizations. So you can see that actually in these are categories. I would look at it, no, categories of or groups of people, no. And if you try to look at it, parang halos lahat actually tayo capable or pwede. No? I highlighted there specifically first responders because I've seen in the profile that most of our participants now are actually also teachers. So if you say, I'm a teacher, so baka hindi ako pwede, or baka we have our guidance counselor in our school, they are the ones who should be doing first aid. Actually, no. No, you can't actually do it. Remember, in management, sa teacher education, one of the models that I'm not sure if you're familiar with it, is yung, familiar, especially sa DepEd, no? Yung TAP, Teacher Advisory Program, di ba? It's stated there that in counseling, kasama kayo doon, no, as first responders, because kayo ang first na nakikinteract sa mga students, no? And people who experience this are probably like, your students, and as teachers, you have to equip yourselves, no? And it's good that we have teachers really here who are here or who are part of this session, no? So that mabuhayan sana kayo ng loob na at least i-enhance nyo pa, no? Willing pa kayo i-train yung sarili nyo about PFA, all right? And to know more about PFA, so that you could deliver it to your students, especially again with our situation now. A lot of things are going on, and with these changes that we experience, especially our students, they need actually PFA. And here in the university where I'm affiliated with, we've been doing it sa lahat ng klase, no? Every class, in every program that we have, in as much as possible, we try to reach out to them, no, doing PFA, because sabi nga dyan, one of the sources of stress would be abrupt changes in life, right? This pandemic has brought a lot of changes in us, in the student in the life of our students, like from physical contact to basically at an instant online, and everybody has to adapt at a faster speed, no? And has to learn a lot of things at the same time, no? How to become techie, more than just playing ML or online games, more than Facebook, more than social media. There are platforms that they have to know. And, the students who are not into this has to upgrade themselves. And, doing this can be, stressful for them at least. Dagdag pa yung mga magulang, no? Ng mga magulang na hindi rin alam. So, meeting itong mga tao na nag-meet na not so familiar, tapos nahihirapan, the environment could be very stressful, no? And PFA can help actually ground them na okay, everything would be all right, no? And you can manage, or just allow yourself, give yourself a moment to learn, yung mga ganyan, no? And again, these are things that are provided by PFA. All right, what else? No, as teachers, crisis, no, personal crisis. And even death also, just because of this pandemic, no? Crisis in class, like for example, personal crisis, na personally, apart from hindi sila makapag-cope because of this one, meron pa silang ibang pinagdadaanan. And as teachers, your first responders, just to share, lately, very recent, this was last week, I have a colleague in the past, in the first institution I've worked with, na nasa DepEd na ngayon. And it's sad, no, na sa school nila, they don't have guidance counselor. And ang dami-dami palang mga concerns sa mga student nila na sinasabi sa mga teachers na, and these teachers actually are, in Ilocano, agkamangawang da, nahandaan mo. They don't know what to do and how to approach this or how to address these concerns. And when you try to look at it, these are actually crises. These are stressful experiences or events that happen in their life. Like for example, abuses, physical abuse, sexual abuses, and PFA actually, when students or pupils come to you and open up these personal problems, at least PFA should be provided. Kahit wala pa yung immediate na sabihin mo, or you go for counseling immediately, pero at least yung idea lang of providing the basic needs, and help that you can do. That's why it's important as teachers, we really have to the way I see it, it's important as teachers that we really have to acquaint ourselves about what PFA is, and understand more about this PFA. So I have this friend, going back to my friend, ang dami lang concern sa students nila, sa pupils, because pupils, because they are in grade 7 pa. Na may isa na hindi niya daw alam na the child has been molested, by a family member. So these are crises, that has to be addressed, and immediate at ang pinaka fastest, or the fastest and the quickest and the best way to address this in the meantime as teachers would be delivering PFA. All right. Others here naman sa experience dito sa school where I have, just on the start pa lang ng klase ng first term namin dito, one of my students from psychology, papasok pa lang siya a day before, right after my talk to them, committed suicide. Yung mga ganyan, and we really have to do PFA to address the classmates, now who've known about this situation or this case, because it might just create contagion, and we don't want that. Dadagdag pa sa kung anong experiences nila with this pandemic. And again, first, these are just examples that I'm sharing, that PFA is very much appreciated and it should be worked out. All right, so there. So I hope it's clear that regarding who should be delivering PFA. Again, technically, lahat tayo is capable, for as long as you have the right skill and you've underwent training. Because again, PFA is something that's learned not over time, but it's actually a training that should undergo. It's not a hindi kagaya ng ganito, na after this talk sabihin na pwede na ako. No, because there are things that you need to know more, and it's not part of the coverage of our talk this morning, because this is just like 1 or 2 hours. All right. All right. So another one is that, where is it performed? So if you ask, so sige, fine, saan ba pwede? Saan ba natin ginaganap or ginagawa ang PFA? So basically, everywhere, for as long as there is crisis and need is sought, or its need is important, or help is sought for. So PFA can be used where disaster services are provided, such as assistance centers, response centers, and mass dispensing sites. Or again, kung saan kailangan talaga ang assistance to stabilize individuals or group of people, or students or pupils. So pwede sa classroom. You can offer PFA wherever it is safe enough for you to do so. All right. So, and again, for as long as the need is yung need is there, and you feel like the people have undergone a stressful or distressing experience, then definitely PFA should be delivered. All right. And aking point. Right. So, hi, sir. Hi, Ma'am Brian. So, shout out lang. All right. So, if you ask again, especially for teachers, paano yan? Hindi naman kasi hindi kami mental health professional. Fine, naintindihan namin na as teachers, as first responders, aligned with yung TAP model natin. Okay, so we can do it. Pero yung principal namin, ang hirap i-convince, or they don't understand, or they don't believe the idea or the concept of PFA, or they don't even give priority, or they don't even, hindi man lang nila pinapansin yung idea na to, na at least we have this legal foundation. Para pag gumawa kayo ng proposal ninyo, sabihin niyo, sir, ma'am, beke naman, gusto niyo i-consider. We need this. All right, so we have this legal foundation with just basically getting it from RA 11036. This is already a law. You know that for a fact. I think everybody is familiar about it, or known as the mental health law. And it's stated there that mental health should be integrated, and mental health, PFA is part of that, enhancing or encouraging good mental health, or facilitating mental health. So it's important. So diyan makikita niyo na kailangan natin ito. A state of well-being as defined by the law. Mental health is a state of well-being where one realizes their abilities. Now, when an individual is under distress, do you think, and that under stress or distress that can even elevate or escalate to a more serious problem, do you think they're capable of realizing or being able to contribute more to the society? Definitely not. So with that, we need this. You know, we have to have this once, and we have to have this PFA incorporated actually, which is one of the researches I've found, the literatures I've found. Ang tawag dito, PFA should be integrated in the curriculum nowadays, especially more than ever now, more than ever. You know? Because again, things are changing very quick in our society now, and PFA has to be incorporated in the curriculum. I mean, speaking to teachers at least, you know? Or even other organizations, you know, in your offices, respective offices. You know? It should be part of it, you know, as part of your mental health or well-being programs. So PFA should be there because you just never know. A group or an individual might be undergoing something or a stressful event in their life, and you know, with the PFA that you provided, you might be able to help them out. No? Bigla-bigla na lang silang nagre-resign sa trabaho kasi may pinagdadaanan. Eh kung may PFA sana na na-deliver sa kanila, baka you might have prevented that from happening. So if you're administrators, I think hopefully this could be something to think about. All right. So, ayan. So just to go back, no, before we get into our next objective, no, establish lang natin. So what is PFA? Again, PFA as defined by WHO. Review lang, no? Review para hindi tayo mawala lahat. All right? Para at least consistent at you're still with me. Sabi ng isang teacher, professor ko, journey with me, just to borrow. Shout out if you're watching Ma'am Ads. Doc Ads, all right. Doc G, and we call her. All right, so, ayan, what is PFA? So again, it's a method or it's an approach that we do to be able to help provide, assist, facilitate people who are in distress or who are experiencing crisis, you know. So, and who does it? Everybody actually can do it for as long as, again, they have the proper training and knowledge about PFA, all right? And when should we do it? As much as we see the need, actually, you know? Like when somebody experiences a crisis, deliver agad, no? No, basta you have to make sure that, you know, when somebody is going through certain experience in life, basing it from the slide I've shown, no, yung mga experiences in life that can trigger high or extreme crisis or distress in us, then definitely PFA is or should be delivered. And where should we be providing this? Anywhere, for as long as the need is sought and you feel like somebody or an individual, a group of people is undergoing stress. All right, so there. I hope we were clear about that. All right. So moving on to our second objective. Ayan, kala nyo na nakikita ko pa siya. So moving on with the second objective of our session, you have there understanding the core principles, how and why this PFA came about. So it's guided by these core principles, again, as adopted from WHO in 2011. So it's promoting a sense of safety. Ito yung gusto nating mangyari, no? And promoting calming, no, experience to people under stress or distress, all right? And promoting sense of self and community efficacy, promoting sense of self in a sense na, okay, after a certain event in my life, a crisis in my life, na I never lose myself in the process. Because again, you have to understand na individuals are different, no, and they look at crisis differently, and they experience crisis differently, and they address crisis and they respond to crisis differently. So we have to let them understand, no, na in the process or kahit anong mangyari, we have to secure and protect them from not losing themselves in the process. So kung kahit anong crisis pa yan. And again, that's why we have this PFA. And promoting connectedness, you'll see there in the models I'll be showing in a few that, you know, your idea of why connectedness is important also, right? And instilling hope and empowerment. Ito yung sinasabi ko yung activity I remember yung introduction in 1986, no, that activity should be done right after the crisis, after the crisis experience or situation, para madagdagan or mas ka-fold pa yung recovery quote and quote, probably, or yung yung grounding, yung coping, yung pagbabalik na sa coping state nila ng mga people who have this kind of stressful experience. All right, so those are the core principles that guides what PFA is. And if you try to look at it, this actually encapsulates yung humanistic perspective na nakikita dun sa box that I've shown with the earlier slide. All right, yan. And moving on, and the action principle, which is actually guided by the different models that we do, or first aiders does. Kasi nga baka, hindi naman tayo lahat dito. Again, in the group are responders, first aid responders. All right. So these are the models that they do in doing psychological first aid. So this sounds familiar and this looks familiar to you, no? So ang daming sumagot din, remember, dun sa survey na tinanong na sinend sa inyo. So what comes into your mind about it? And a lot actually has responded about the 3 L's, no? This which stands for look, listen, and link. And that's true. And this is actually one of the most popular and prominent way of doing PFA. No? This is the action principle of PFA, to be exact, from the guidebook that was published, or that was introduced by WHO in 2011. Na from that year moving forward until now, ito actually binabalik-balikan, no, ng lahat ng organization, lahat ng mga groups who are going or who are introducing PFA, no? Because the idea there, it's structured in a way na kahit hindi ka mental health professional, kaya mong i-deliver. No? And again, it's guided by this one. So you have there the first L, we have a look. So what you do when you actually introduce PFA is that you have to check for safety. No? Before everything, after everything that you've done, the pre-orientations, pre-orientation, yung mga preparations that you do before you respond to a certain situation. So after you've done that, here are the things that you need to do. So you have there, it's guided again by the 3 L. So you have there, look for safety first. No? Check for people with obvious urgent basic needs, and check for people with serious distress actions. So you have to be very vigilant. As responders, you have to make sure that, okay, nasaan ba kayo ngayon? Like for example, if you are in an evacuation center, ano ba, safe ba yung kung saan nyo gaganapin yung PFA, or yung tao mismo, ano ba, meron ba siyang matutuluyan para maprotektahan siya sa environment, like for example, sa ulan, yung mga ganyan, o meron ba siyang tent. But that's basically looking for safety. Ayan. Or in terms of abuse naman, look for safety in the sense na uuwi pa ba siya sa kung saan yung environment, nandun yung perpetrator niya, yung mga ganyan. That's one way of looking at it. No? Yung, like for example, yung mga students natin who are experiencing anxiety that can even, escalate into, depression, yung mga ganyang other serious concerns, mental concerns, look for safety. Like, sino mga kasama nila sa bahay nila, yung mga ganyan. No, these are the things that we have to look at. No, and check for people with obvious urgent basic needs. So, you prioritize. No? Check no, sige, ikaw, meron ka ng ganito. So, sino pa ba yung mga wala? Para pare-parehas kayo dapat safe. And check for people with serious distress reactions. No, who needs more attention in terms of need, no, psychological need probably, or not necessarily psychological need, but probably medical attention, yung mga ganyan, like in terms of disaster or anong mga physical crisis, no? Kung sino yung mas nangangailangan, like for example, o baka siya kailangan niya ng mas immediate na attention in terms of medical need, like dahil sa disaster ngayon, naputulan siya, o siya muna yung i-attend natin. That's what, as first responders, these are the things that you have to consider and you have to look for. No, kaya sinabi dyan, look. Alright? And another one you have there, listen, all right? So listen, this basically tells us or tells the responder that you have to approach people approach people who may need support. No? From the term itself, makinig, no? And you being able to listen would give you a better perspective on what help should be delivered or what things should be provided to them. No? Listen in the sense na, okay, you do not do hindi ikaw yung dada-dada dyan, no? Chichika-chika, no? Well, part ng pagiging human nature natin, no? Na, okay, pag nandun tayo, we interview them immediately, no? Not necessarily. As first responders, hindi ganun yung atake natin. We ask, and we let them talk more to express yung nila, yung experiences nila, no? And ask about people's needs and concerns, listen to people and help them feel calm. No? So if they feel like kailangan nilang magsalita, let them, no? Makinig ka lang. Kasi kung minsan may mga ganon, no? Again, sabi ko nga, iba-iba yung expression ng stress and distress ng tao. So meron kasi yung iba na ang way nila of, letting themselves calm or, settling themselves or grounding themselves to be yung may vent out nila, and then you allow these people to do that. No, if they like, kung minsan ba yung may iba na apart from that, yung pag-vent out nila and yung pag-vent out is through crying, paghahagulo, then allow them. That's listening itself. All right. Another one is link. No, so there you go. It's not enough that you do the first two. You listen for you look for what they need, and then provide what's necessary. And then you try to listen to their concerns and other things that they need to share, they need to talk about in terms of their experience or the crisis that they're going through. But you also have to, after that, you have to link them to the necessary organizations, offices, or help, basically providers, no? Link them, like for example, you've seen na baka mas may kailangan siyang mas serious yung pangangailangan niya in terms of medical attention, or you link them to probably a hospital, or to a doctor, that's part of linking still, all right? And help people address basic needs and access services, help people cope with problems, cope in a sense na, okay, so you've done your part, you've secured as first aider, safety responder, naibigay mo na, okay, na-ground mo na sila na kailangan na nila yung basic needs, na ibigay na sa kanila, nasagot na yung pangangailangan. I responded to their immediate concerns, pero you found out that parang medyo extreme na yung sitwasyon. Maalala niyo sa line, if they're gearing towards yung line, the more serious concern, you have to link it. You have to refer them. Ayan, yung referring part is linking. Refer them to probably a more appropriate person who should be addressing the concern. Like for example, paano kung nagkakaroon na siya ng other manifestations, mental concerns, no? Manifestations in terms of, baka nagkakaroon na siya ng delusion, hallucination, mga ganyan. Baka gusto mong i-refer na for probably assessment ng ibang office, ng ibang experts. No? That's part of linking. Right? Linking also could be connecting back to other people, like to their family members, no? Like in terms of, biglaang nagsitakbuhan lahat-lahat. Like for example, pinatubo, nagsitakbuhan lahat-lahat ng mga tao to safety themselves. Pero yung iba, naiwan yung ibang member ng pamilya nila, lalo yung mga bata, no? Linking would also mean that you have to find people, yung mga kasama nila, no? Kapamilya nila, no? Bring them back to their families or to their group or to their organization. All right, so that's also part of linking. All right, and these are the things that you need to do when you become a first aid responder or a first aider, a psychological first aider. All right, so these are basically the action points that I can share in relation to the model or to the guide that WHO or World Health Organization has introduced. Again, we can have a training for this one. You can have a training for this one because there's a lot more that you can actually understand about the 3 Ls and how to attack them, yung mga ganyan. But I'm just giving you an overview of it, right? Because again, our time is medyo kulang. Hindi kakayanin, I tell you. All right, so that's one model that I'll be sharing to you. And another one, as is promised, you have there. Yan. So I'm not sure if you've heard about it or if you've met it in the past. So siguro meron sa inyo mag-react kayo dyan. Kung meron, raise your hands probably. No? If you've met this is actually a course that you can take. Oh, by the way, it's free. You go to Coursera and then you can actually get certified. You just have to pay if you want to get the certification. It's like during those time nung kinuha ko ito, it's like $60 yung certificate, but you can actually do it. But I'll be sharing to you this concept. I find it appropriate to share because apart from the 3 L's ng WHO, mas may other addition ito, no? In relation na mas, kumbaga, mas relatable din sa iba, no? Sa mga ibang responders who would want to become a first aider. All right? So there. Before we get into the third model, tingnan ko lang ulit muna yung chat box ko. Chat box talaga. All right. So anyway, are you still with me, by the way? Are you still okay? Wait. Yeah, can you raise your hand if you're still okay? Let me know if you're still okay and if you're still with me. Yeah, I'm not sure. This is a new. Yeah, I can see people like, hi, they're waving their hands. Hello. Yeah, I'm used to with one of the BPOs I'm working with right now. I'm doing wellness sessions kasi with them. Parang hindi ako sanay na walang nagaganap sa chat box. Every time when I do this kind of wellness session online, active kasi yung chat box. So at least I know that they are still with me. Yan. Yan. Okay, there. Nakikita ko. Sige, balikan ko yung dito sa akin. Zoom. Yan. All right. Participants. All right. Yeah, so at least you're still with me. All right, so moving on to the second model that I'll be introducing would be from Johns Hopkins University. So this is a product of research of this particular school in the West. No, so they came up with this model to use as guide when they become first or for first aid responders. So it's called RAPID, and it stands for this is actually it's not an acronym, but it's it's every letter stands for a certain word. No? I'm lost with words. It's not an action. It's in my tongue anyway. Yeah, so it's rapid, and R stands for reflective listening. No, the goal of this one is to make contact, provide an introduction, establish rapport, use specific active reflective listening. Yeah, man, listening. Yung kumbaga balikan niyo yung kung i-compare natin, it's not balikan, but kung i-compare natin dun sa 3 L's ng WHO, ito yung yung listen part niya, no? Yung listen part ng WHO. So when you get to accordingly, when you go for when you respond to a certain crisis or a certain crisis and to a group of people or to an individual, reflective listening means you just allow them to share their experience, no, guided by some few questions to at least elicit the things that you need to know, but not necessarily you doing the talking, no? Kung minsan napapangunahan tayo ng ganun, no? We wanted to know more without even actually understanding or without even actually trying to grasp what the other person is talking about, no? It's very important that when people, when you are there and you listen to people who are undergoing crisis, and when you attend to them, no? Number one, yung nandun ka na lang mismo is actually enough. But allowing yourself to get these information from them or listen basically to them is another one. So these are the things that you need to know as first aid responders. Also, we have to bear in mind, that listen first before we do a lot of talking. All right, often referred to as active listening. All right. And it's an ongoing, according to JHU, no? So it's an active, ongoing process used throughout the entire interaction. So reflective listening, like for example, andun na yung papasok dito yung skills about paraphrasing, about summarizing, yung mga ganyan, about clarification. And again, these are trainings that you should be doing if you really want to become a first aider. Right? And again, it's still part of the yung 3 Ls na ginagamit commonly nowadays. All right, so another one is, that's for R. And, oh, sorry. Yeah, so sabi dyan, there is nothing so powerful as as the well-phrased question. So it's, yeah, that's true. No, it's important, no, that when you listen to this one, make sure na hindi attacking yung the way we ask questions. So we want to know more about these people. No, hindi nagiging intrusive, hindi attacking yung pagtatanong natin. So just basically asking, how what happened, can you describe to me how it happened, or what are you feeling right now? These are just basically things that you can ask people about in relation to their experiences that would facilitate actually a conversation with them. All right, so another one you have there, A stands for, from GHQ still, you have there, or from the model rapid, you have their assessment. So assessment of basic physical and psychological status. Assessment in a sense, ito yung lalabas na yung skill din natin about, quick, yung dapat mabilis tayo na tumingin sa kung anong nangyayari, about kung sa WHO, so kasama ito sa look part nila, sa 3Ls nila, rudimentary assessment is derived from the guided conversation involving the survivor's own narrative. Assessment, like you would be able to check na tuliro pa ba siya after the crisis, or coherent pa ba yung pagsagot niya, or incoherent na, because it's from this assessment that you're able to establish linking or referral. Yung sa link dun sa WHO, and here dito nandun sa last part, sa D part niya. Alright, so, and then through assessment also, doon mo ma-identify kung ano yung mas kailangan niya at kung ano mas priority kailangan yung gawin. Alright, which leads us to letter P, prioritizing or prioritization. That is attention as focus. Attention is focused upon the people who require urgent, emergent care. Basically, kung ano yung mas kailangan at pangangailangan ng tao. That's it. Or that's for prioritization. And you have there by the way, in relation to prioritizing, it's seen in two approaches according to JHU. So you have there the risk-based and evidence-based. So in trying to prioritize, you have to look into the risk. Mas risky ba yung situation niya ng tao, ng individual, and after the certain crisis or certain adversity in his or her life, or in their life, or in their experience. Risk-based, like for example, again, in terms of, for example, abuse, or risky in a sense na uuwi na naman ba siya dun sa bahay kung nandun yung perpetrator niya, yung mga ganyan. That's risk-based. In terms of calamity, like for example, are they still going back to their place? Ay, alam nila na nakakatakot, prone sila sa landslide, or nag-landslide na nga yung buong based on the other hand would be what are the evidences that would support you saying na okay, medyo incoherent na yung sinasabi niya, yung mga ganyan, or evidence in the sense that I should be referring, or I should be linking this person to a more to an expert, or to a more to a better facility, or whatnot, or yung mga mas bibigyan siya ng attention in terms of sa need niya. Like, for example, incoherent na siya, that's an evidence-based, that's evidence to say that I should be referring this to a therapist, or a psychologist, or a medical doctor. Evidence in the sense na naputulan na siya ng kamay, or naputulan na siya ng paa, so nagdudugo na, so kailangan i-refer na siya talaga sa medical emergency. That's evidence-based. This is how we are guided in prioritizing according to JHU using the rapid model. And again, this is just an overview, and you can have a training about this one actually. All right. So another one we have, after prioritizing, you have to do the intervention. Upon assessing the needs and the risk of evidence, implement protocol for intervention, whatever that is, if you have, as a team or as an individual. But as a team, minsan meron mga ganun. Ito yung gagawin natin, step 1, step 2, step 3, step 4. You again, sa WHO model, sa
guide nila, meron yan na-identify yung mga ganyan. Like, for example, what are the questions that you should be asking in terms of the people that you will be interacting, paano mo sila i-approach yung mga ganyan. That's the intervention part here in this particular model. All right, so that's the I for rapid. And letter D stands for dissolution and follow-up. So this serves as the culmination where the help can now be terminated. So, or terminated, or pwede na, if you need to refer, or if you need to follow up, or if you need to link dun sa WHO, the link part, then do so. No? Like finding the family members, looking for family members. Kung wala man, relatives na po pwede niyang mauwian after a crisis or after like a calamity. Kung nawala lahat ng member ng pamilya niya, tapos siya na lang mag-isa na naiwan. So doing the D part there stands for, you know, trying to look for others na saan na siya po pwedeng umuwi. May naiwan pa bang mga kamag-anak, yung mga ganyan na po pwede niyang mapuntahan at least, no, yung mga ganyan. All right, so that's the D part for rapid. All right, so these are the three models that I can share in relation to PFA that you can use. Now it's up to you which actually, if you become a first aider, which model would you use? Could it be the action principle of WHO? That's the 3Ls, or you can also use
Nakadungog ako.
It would work. Yes, hello po.
Korea, kasi Korea ka.
Ayan. Adag sa saong. Is there? Ayan. So, all right. So that's rapid. And again, these are the two different models that you can use and you can adapt. All right. So after doing the training, or the basic training to enhance the skills and doing PFA, you can use this ones actually as guides. All right. So assistance provided does not end nor stop once you say goodbye. So that's very important. That's one thing that you should know. Kaya kasama doon sa core principles that there should be follow-up. No? Na hindi porket na ibigay mo na yung kailangan ng ibang tao or na-provide, okay, sige, feeling ko okay na siya, coping na siya. Nung balikan nyo pa rin, no? Consistent ba na coping siya? Kasi kung minsan coping siya sa sitwasyon, after mo nakausap, coping siya, pero eventually nag-flashback ulit, bumalik ulit siya sa distress state, o baka kailangan ulit na ng tulong, yung mga ganyan. Alright? So, dapat ganon. Para mas impactful yung tulong na bibigay natin, kailangan natin chine-check pa rin sila. And in counseling, we do that also. Follow up. You have to make sure that, or even in therapy actually, no? It should not stop when they say, I'm okay already. No? Or I think I don't need you, or you've seen na, okay, capable naman na siya, kaya na niya to stand on his own, and that's it. No? It should stop there. Alright? So you have to make sure that you do the follow-up still. Yan. So kung sa teacher nga, kung kailangan pang sa ating mga teachers, no, kung kailangan ng mag-home visit, gawin. All right. Ang goal natin is to make sure really that they go back and they maintain it. All right. I think yun yung point natin, and they become consistent with that. All right, with the change and with the development that's going on, and that will happen to them. Okay. So ayan. So nasagot na natin. So we've able to get yung objective number 1 natin. So ano yung basics ng PFA, what, where, who, and what's the definition, and how it came about. So that's number 1. Objective number 2, ay balikan ulit natin. No? Number 2, what are the action principles that guides the PFA? Kumbaga, what's motivating? Kung ano yung kaluluwa ng PFA. No? So we have the core principles of it. And number 3, we've had the different common models or approaches in doing PFA. So I've introduced, from WHO, the look, the 3 Ls, and from JHU, the rapid. And then our 4th objective, we have the recurrent trends or the whereabouts now of PFA now. So I'll be showing to you a study, or I'll be sharing to you a study, and how do you call it? A framework developed just recently in relation to the pandemic. So this came out, after the surge of the pandemic, early this year. So they were able to create this very quickly using the framework of PFA to attend to the concerns of people who are part or who have experienced distress or stress, or not good experiences within this time of crisis. All right, there. So, the outbreak of COVID-19, sabi nila, has created concerns worldwide and has impacted a lot in terms of mental health, like anxiety and, anxiousness, being afraid. And sometimes, sabi ko nga, balikan lang natin nung una na, this situation can actually be some kaya nila, or they're able to, like, it's like they can heal on their own. No, they can manage on their own, but for some nahihirapan talaga sila, no, they don't know where to start again, or they don't know where to go after, no, and doing PFA, no, can actually help them out, no, because again of this crisis that we are experiencing, no? I've shared to you a lot. I mean, I've shared to you. I think I shared an experience regarding this one in relation to what we have now, like in our school. So we've had suicides already, victims of suicide in our school. Diba politically correct now, victims of suicide na hindi na committed suicide. So victims of suicide, yeah. And and we, actually it's brought by the crisis now, kasi one of the reason why the person who did suicide is because of the feeling of isolation. Feeling of isolation, of pakiramdam niya wala kasi wala siyang kasama sa bahay, so it ended up like that, and it's so tragic. And these are the things that is caused by the situation now. And PFA can actually work. I mean, can do that even if there's no physical interaction. So the framework that this particular organization has created is a PFA doing it online, doing it remotely. All right. So it's still the same actually, no? So it's still the same yung models. Actually ang framework na ginamit nila, or ang model na ginamit nila, is the 3Ls also of WHO, but it's done online. I mean, it's done remotely or through phone. So self-quarantined persons, these are the situations that everybody is experiencing. Again, the organization who created it is right there at the bottom. You see there, International Federation of Red Cross and Red Crescent Societies. No, that's they had this in March 2020. No, so accordingly, people, self-quarantined persons, ito yung mga nangangailangan na nakita nila, no, who actually needs immediate PFA, or who needs PFA more than anyone, as brought by this particular crisis. So you have their self-quarantined persons in homes, hotels. In fact, here in the Philippines, sa isang group where I'm affiliated, the clinic where I'm affiliated, we are actually doing this also. Yung mga self-quarantine people, specifically yung mga returning OFWs. To be exact, ito yung mga seafarers. So we're doing PFA for seafarers, no, who are in the quarantine facility before they get transported back to their provinces. And the general population who may call for SIG or information, yung mga ganyan, yung mga hindi alam, the anxiety that they feel because they don't know what's going to happen after this crisis, and PFA actually can help, just basically facilitating their emotion with the uncertainty of the situation can actually help them out, really. All right, and health workers and social welfare responders providing treatment to patients, no. We've had that also. We've been invited, yung isa sa grupo pa rin where I'm affiliated now, we've been invited also to provide this to and I've known some of my friends and colleagues who are doing this for free, actually, also for healthcare workers, no, or frontliners, we call them here dito sa Pilipinas, so mga doctors and nurses. So they visit them to their quarters. For some they do that, but for some they do it online also. All right, and provide people who had recovered from COVID-19. So yung recovery process, because it's really, I mean, yung impact, the stigma that's brought about by this health crisis, no, for these people who contracted the virus. After that, hindi natatapos na they're physically okay, no, after medication that they're okay. There are things that they have to work out pa. after paglabas ng hospital, like going back to, you know, incorporating themselves to the society despite the, you know, the stigma, and which is something na hindi natin makontrol, no, sa ibang tao. May mga ganun talaga, no, na like for example, pandemya, and you've heard a lot of news actually about that. They just got evicted from their houses or when they're renting because they contracted and they recovered from the virus, thinking kasi baka hawa pa daw sila, yung mga ganyan. Ano pa, and a lot of cases here in the Philippines, and not just here, but actually worldwide, no? That's what about by this one. And PFA would really reintegrate them back, all right? And families and friends of deceased, a lot really, hindi pa natatapos pa nga yung mga grieving families, no? Kasi everyday parang may nare-record pa tayo ng death. At least here in Southeast Asia, Philippines is pumapalo, no? Na walang patid, no? Parang gusto may mapatunayan, char. All right? So, caregivers with children at homes due to closure of schools. Yes, exactly. No, and not just children and not just caregivers, but even employees, no, who just lost their jobs also. All right, and PFA can actually help facilitate their experience. Another one, older adults, no, other groups with previous vulnerabilities such as mental health disturbance, mga ganyan. Kasi baka it might just provide another trigger for them, no, and imbis na Ilocano tuloy, no. Instead of them trying to recover after some time, pero it's brought by this pandemic, baka mas mag-aggravate pa and may even cause even to more complications or create more complications, all right? And abuse problems that may be in need of support. Because of the lockdown, again, you've heard a lot of news, no? Because of the lockdown, a lot has been going on there, and most often they are unreported sexual abuses. No, and even physical abuses, because wala na eh. When you're at home, ano pa nga ba mangyayari? What would you expect? No, you can just imagine. No, just being at home for like months, you cannot go out, so everything can be possible. All right, and especially for people who with a big family, no, and staying in one roof, so things can just really happen. No, and you know, these are things that we need to look at. Sorry, it fell. All right. So that's how the assessment done by this organization, that actually PFA is very much important. Ayan. So this is how they do it. They strategize it. So their plan of action, as guided still by the 3 L's you have there, they have to plan and they have to open in the conversation and listening of needs, listen to the emotional and practical needs of these people through phone. And in their, I can send the material actually if you want, if you're interested about this one. So meron daw yung proper way of, you know, para kang yung parang pumasok ka sa BPA sa training, sa first month of training mo. Parang ganun ito, no? So they introduce to you, or they have pointers on how to open a call, how to end the call, yung mga ganyan. What questions should be asked. There are the things. These are things that actually are incorporated or included in their guide. No? And then through that, you have to make sure that you ground these individuals or whoever that you are interacting with, no, or whoever you're providing the PFA online or over the phone. So calm them and then link them after. So makikita nyo dyan, andun pa rin yung listen through this one, ayan, the call, and then look, ayan, parte siya ng calming process within this process, and then the link part. So 3L, nandun pa rin yung 3L. No? Alright, so that's one, and with their study, it helped a lot actually. Well, wala naman tayong talagang, it has to be effective, and it has, they really have to innovate kasi that's the only way to reach out there, especially with the lockdowns that's happening. So yeah, it worked, and it helped somehow according to this group. All right. So here are the do's and don'ts introduced that they found out, and they want people who would want to go into phone PFA or online PFA. So you have there some guides and a lot more actually in their module or in their training guide. So you have there the do's and don'ts. Listen in doing the call. You have there the do's and don'ts stated there, so you can read it through. And again, I can send the link. Just let me know if you need or if you want to know more about it. I can send the material. All right. Ingat. So key takeaways of this one, I think we're almost done. All right. So key takeaway of this one is that I getting it from the structure of the three L's, the core action of WHO. I made also three L's. So number one, you have to learn, equip ourselves, and upgrade often. So I think this is just a start for, especially for others, for the others who doesn't have familiarity or who are still learning about PFA. So this is a good start for you. Again, as set early on, hindi ito yung actual workshop. This is not a workshop and a training for PFA. This is an overview. You've seen it in the title of in the beginning slide that this is an overview of what PFA is. So should you wish, again, should you wish to have a training, you can actually have that. You can look for a provider who could deliver that for you. You can invite people, also experts who can provide the training for you. No, and again, kung sa pinakita ko, may legal foundation tayo if you wish, so that if you need for others who have this idea na okay, siguro baka kailangan namin i-deliver sa grupo namin. So at least kung mag-propose kayo, gumawa kayo ng proposal, mayroon kayo pinanggagalingan. Alright, so again, learn, equip ourselves, and upgrade very often in terms of, the skills that we need, alright? If we really want to help, alright? There. And another one for the 3 L's that I have for takeaways, you have to do launch. Be an advocate and know that PFA is a must now more than ever. Again, especially with our situation and with what's going on with our society now, PFA is very much needed, really. Gone are the days that PFA is seen as, okay, hindi naman niya kailangan kasi meron naman yung mga expert dyan, ibigay niyo lang sa kanila. No, not necessarily, sana hindi natin tinitingnan that way. So it's a need that everybody has to have or has to experience, at least after especially a certain crisis that they went through or adversity that they've experienced. All right. And then last but not least, you have there, like. No? You have to make sure that you like what you do, appreciate and love what you do. No? Kasi sabi nga nila, the more that you like it, mas nagiging authentic yung naibibigay at na-deliver natin. No? This is one thing that I challenge, and I've heard this from a lot of my mental health professional friends na when they do PFA, mas nangingibaba yung profession nila more than their ability to help. And I think that's one thing, even me as a professional, I look into and reflect every time. When you do PFA, more than the profession that you do, kasi kung minsan nag-overlap pa no, yung practice mo, yung profession mo, and then the PFA na dapat mo i-provide. So you have to make sure na i-settle na yan sa sarili natin, and then you love it. I mean, appreciate it, no? You just basically are there because you wanted to help more than anything else, and you would want to impact to somebody or to someone's life. No, you want to facilitate and be part of their journey of recovery or of their development or of getting better. All right, so I think that's one also that I can share. And let's try to instill hope. This is one thing that I really like from the comments or the answers that or responses that I got from the survey I sent. No, and which is looking at it. No, I think this is what we would want our or the individuals that we interact or we deliver PFA with. In the first place, kasama ito sa action principles, sa core principles na empowering. No? So this is one of it. No? So let's try to instill hope that despite their adversity, despite the crisis that they went through, that they still have a lot of opportunities and chances in their life. No, that's ahead of them. That they just have to allow it to get in and settle sa kanila. All right, and in that, definitely resilience will be enhanced. No, sabi nga, I say enhanced because sabi nga na lalo na Pilipino, sabi ang resilience natin nandyan no, mas mataas. So probably it would be enhanced pa. No? So with what we do, if we like it, and we deliver it the right way, and accordingly, properly, then definitely we would establish a more resilient individual and the society in general. All right, so I hope I was able to share to you something in relation to psychological first aid. Uulit-ulitin ko po, if you've set yourself na this is a training about PFA, not just yet. Again, I just gave you an overview because if you would want to be a responder, you have to go through certain trainings, at least, no, para lang maano natin, maano ninyo, ma-enhance ninyo. Kasi may mga do's and don'ts pa na kailangan i-practice at i-memorize, no, at tatandaan. Kasi and there are preparations that we need to, and introductory parts that you need to understand and you need to know about PFA before you do PFA, and which is something that I did not cover for this particular sharing because I really wanted, just basing it from the profile kasi of our participants, hindi lahat nandun sa 7 and up papuntang expert na participants. Alright, otherwise, if nandun tayo dun sa part na yan, baka we would look into other models that we can apply, yung mga ganyan. Pero just to at least ground everyone or nasa equal pacing tayo lahat-lahat. So ito yung presentation na na-prepare ko sa inyo. Alright, so do you have any question po or any clarification? Now I'm open for bashing, for comments or anything you'd want to ask. Okay. So how can we avoid or minimize transference when applying PFA? Oh, sorry, I already entertained the question. Yung sa mga host natin, so I jumped to it right away. All right.
Yes, sir. Okay lang po.
Excited, Sir Jeff. Excited lang ako.
Okay lang, sir. Go ahead, sir.
Right, so somebody asked, no, sabi niya, I may ask, how can we avoid or minimize transference when applying PFA? Now, remember, sabi ko sa inyo, if you are a mental health professional, when you provide PFA, I think you have to put that aside in the meantime kasi mas mangunguna yan, parang mas mangingibabaw yan, more than your ability. Ang goal, remember the definition of ang goal ng PFA is for you to be able to provide help, security, protection to the individual undergoing crisis. Yun ang lagi natin tatandaan. No, transference only happens after supposedly. No? And with this particular direction, parang nakikita ko dito is mas nangingibabaw yung pagiging mental health professional. We don't actually need to end up or experiencing that if we understand really what PFA is, no, and what's the goal of PFA. All right, so I hope naklaro natin yan, Aimee. So transference should not actually happen talaga, no? If we are really doing PFA accurately and properly. So kaya sabi ko, it's skill and it's a training that you have to go through for you to really understand, appreciate, and know what PFA is. All right. Hindi pa ako, Doc. Pagalitan tayo. All right. Anyone? Anything more? Meron pa po ba? Meron pa po ba dyan kinukurot ng espiritu? Sabihin mo na yung tanong mo, now na. May next speaker na, sige, hindi na ma-address. Yeah. Kinukulot ng espiritu, sabihin, alam mo, may tanong ka, sabihin mo, share mo na, dali. Alright. Yeah, sure. Sir Jeff, sabi niya, question, sir, what were the difficulties have you encountered when you facilitate PFA to your clients? Difficulties on a personal level, preparation. No? Kung minsan, bigla ka na, especially when I had my first experience, my first contact with PFA, na bigla ka lang hinugot, pinunta ka doon na walang orientation. So I think it's one of the challenges and difficulties I've had, no, na paano ako mag-uumpisa, or how would I start a conversation, and that's why training really is important for PFA, because in training you'll know, malalaman nyo how to, to start a conversation, to open a statement na it won't feel like intrusive and culturally appropriate. Ayan, these are considerations kasi, no, when doing PFA that we have to look into, no, para hindi, mabigay natin yung kailangan maibigay sa mga nangangailangan. So I think that's for me one of the difficulties. Apart from that would be the cultural differences. No, that's one of the difficulties also, especially in terms of language. No, ano ba yan? We've had an experience, saan ba yun? Na napuntahan ko, tapos we were ano yung ano nila, yung salita nila, hindi kami magkaintindihan. So I think that's one thing that you have to be prepared of, and it's part of the orientation, the pre-planning. If you are part of the group, the pre-planning that you do before you go to ano tawag dito, or delivering a PFA. Hindi yung sasapak ng go, sabi ni Rufame, no? Hindi yung ganon, kasi baka mas maging sakit ka pa ng ulo when you go to the area, or when you're actually on the actual practice. So I think those are the things that I can remember. Difficulties pa, anong tawag dito? I mean, actually, yung mga ito mas maano mo, kaya actually, they are manageable for again, for as long as you enhance yourself. Sabi ko nga doon sa takeaway natin, level up, no? Never stop educating yourself, never stop learning, never stop upgrading yourself, kasi it's actually through these experiences that, you know, make things easier for you probably, and difficulties minimized. Okay, I hope, ayan. Anna FG, sabi niya, have you ever felt like you weren't able to fully help the person, and how did you address? Yes. Okay, so very yes. And it's not just in PFA, even in my practice, no? But well, dahil PFA tayo, so doon tayo mahuhugot. All right. Yes, there are things and there are moments that I felt like, yeah, I wasn't able to, well, at least on my part, no, in my understanding, na I questioned myself, was I able to provide what they needed, no? And how did I manage that? Well, pag ano tag dito, as long as you did your responsibility and what you're supposed to be doing as a first aider, then I think that should be enough. No, sometimes kasi, well, part of human nature naman na we need validation kasi, no? So again, I hope it would be and which is I did on at least sa sarili ko, or for me, no, a consolation na you delivered what you're supposed to be delivering. Actually, you were able to ano dito, meet your goals and objectives, why you had to do it, yung mga ganyan. So that should be enough as a consolation na, okay, I think you did what you're supposed to be doing. Unless pumunta ka doon tapos wala ka talagang ginawa, then that would be a big question, no? Or that's something different. And it happens, no? There are times really that you'll have that. And again, ulitin ko, it should be a consolation on your part na for as long as you did your part, guided by your objectives and the goals, while you're doing what you're supposed to be doing in terms of PFA, then that should be enough, no? You shouldn't be looking for questions na kung minsan hindi mo na masagot-sagot, and then you'd pity yourself. Ayoko nang gawin ito kasi parang hindi ako nakakatulong. Just never know. Right. Right. My 17-year-old son is typically stay-at-home guy, and he is not socializing. Does he need a PFA, or what can I do as a mom? All right. Nung nag-start quarantine, hindi na siya lumabas. So lumabas lang siya kasama ko nung Friday kasi okay na daw yung 15 above lumabas. Yeah, you have to, again, that's part of the assessment part in rapid and look part dun sa model ng ano. You check, do you think there are things that are different na, and do you think that the experience is yung distressing sa anak nyo po, or it's creating, you know, unusual behavior or you know, changes sa kanya, then ito yung mga kailangan nating i-check, no? To say na baka probably kailangan ng sila. Baka naman, not necessarily PFA, but support, or people who just basically people who would listen, yung mga ganyan. These are things that I believe that you get to look into first before we can say na baka kailangan nilang first aid, yung mga ganyan. Okay, may alam ka po agency kung saan nagkakandak ng training ng PFA? Thank you. Agency, sige. Ano to dito? There are agency. Actually, yung first training ko naman, I had it with
With BSU, with my professors there in graduate school. So they've done, and they're good actually also in doing that. And there are private practitioners. You can check it online actually also here in the Philippines. There are. So kung nasaan man po kayo, I'm not sure kung saan, but you can check it online. You can ask other mental health professionals. They have, they can link you to these people. All right. So yeah, and I can, ano ba? I can suggest, probably I can give you some of it. PM ko na lang po kayo. Alright. Yan. Kay Ma'am Catherine. Alright. Meron pa po ba? May mahabol pa ba? Alright. So if none, so I hope one or two or three, mas maganda, is na natutunan nyo sa sharing natin or sa session natin is more than enough, for me at least, for this particular session. So again, thank you so much for listening, and mabuhay po kayong lahat. Matagot-tagot ako. Yan, in there, Cordelia. I really miss Baguio or Benguet or BSU in general. I really wish to be there very, very soon. So thank you so much for listening, guys. And for all the participants, I think meron pang galing south. So welcome po, and thank you and good morning. Yan. Meron pa tayo, marami pa kayong matututunan sa sessions na darating. All right, bye!